Welcome to On the Beat, everyone. I'm over here with Dr. Ricky and Dr. Richard from Gastroenterology, Associates of Columbus, and I wanted to sit down and have a whole conversation about the men behind this type of business and, of course, the profession that they chose. Welcome to the show, my friends.
Thank you.
Alrighty, now this is going to be a tough one. What is a gastroenterologist? Did I say it correct?
You did.
Okay.
They teach us that on day one of our fellowship is how to pronounce gastroenterology correctly. But a gastroenterologist is a physician who has completed a residency in internal medicine and then has gone on to specialize in basically any disease, illness that affects the gastrointestinal tract, which we define basically from the esophagus to the anus.
Okay.
And any of the symptoms or diseases that may fall within that.
I got you. So you were saying that you do your basic medical training first and then choose this as a speciality, correct?
Right, yeah, it's 4 years of medical school. And then after that you choose an internal medicine residency, which is 3 years after that. Some of us may choose to do a chief year. And then after that, it's another 3 years to specialize in gastroenterology. So you're looking at 10 or 11 years.
I was about to say, did I just count that up as like 9 years?
10 or 11 after college, yeah.
Before you are practicing full time, or is that the process? Wow, that's a lot, people. Yeah. That's a serious amount.
Yeah, we're proud of the training that we
I was
do.
gonna say,
I mean, it's very important. We come out of all of that training very skilled, able to be good at our profession, and there are other people who do what we do that don't have that training, and we feel like it's important to have that training.
All right.
In addition to the learning the actual procedures that we perform, we are trained to deal with any of the findings that we may find, any of the diseases that we diagnose, evaluating the whole spectrum as opposed to just doing a procedure and then passing the patient along to somebody else. We treat from beginning to end.
Really?
Everything that we encounter.
Well, what are you treating? Let's talk about a couple of those areas, because when you come back later on, we do want to break them down. So let's do a little overview, if you wouldn't mind.
Sure. So, I mean, by organs going down the track, we deal with a lot of acid reflux, difficulty swallowing, diseases of the stomach, including peptic ulcer disease, H. pylori, liver diseases, people with abnormal liver tests, fatty liver, something that we may want to talk about down the road. Yeah. Pancreatitis, obviously colonoscopies, where we spend the bulk of our time in screening colonoscopies for colon cancer screening and prevention.
Where do we stand, if I can jump in there, if you wouldn't mind, where do we stand in the state of Mississippi for men and colon cancer awareness and disease compared to America?
We have a big push right now in Mississippi to get more people screened, and that's going pretty well. Overall, I think we don't screen as well as the rest of the nation, but screening is very important. These initiatives like 80 by 2020 are very important initiatives by the cancer societies that are.
I think it's super important. Can I ask, as two guys, why is it that men don't take care of themselves and think, like you're two male surgeons who specialize in this type of work? I've done these type of interviews for years. I still can't get it through my head. But then I'm also part of that culprit.
I think there's a number of possible answers there. Men tend to be more stubborn. We tend to ignore things.
She'll be right.
Yeah. I mean, a lot of the people we see in our office come in at the urging of their wives. I mean, we see a lot of twofers in the sense that the wife will come in and have a procedure done just to get her husband to come in and have it done after her. So
it's when they see these type of interviews and they go, you know what? I am maybe at risk of colon cancer because my father died at 65 and we need to go and get a checkup. Guys, I want to talk more. We're running out of time, but will you come back?
Certainly.
I'd really appreciate it. If you want to find out more about Dr. Ricky and Dr. Richard, there it all is up on the screen for you. Give them a call and start your life on the right foot. Get it all sorted, everyone. Back after this short break.